Hi, Elisa. Alles gut bei Ihnen?
Hi. Ja, alles gut. Und bei dir?
I can't hear you. It seems that the mic is active, but when you speak, it's not.
Let's try to make it more sensitive. Do you hear me?
Hi guys, this is Noor. How are you? Hi, this is Noor. Hi, Ibrahim.
Test.
We can't hear you, Elisa. So, hello, everybody. Elisa, if you want to ask something or so, I think you will need to fix your microphone. Hello, everybody. I'm sorry, I didn't tell you before about the language of the presentation because I was not sure who will join, but now because not all of us understand Arabic, so it will be in English. So can you please just tell me in the chat room that everything is good and that you can hear me?
Test, test.
Does anybody hear me?
Yeah, we hear you.
Perfect.
Do you hear me now?
Elisa, if you are speaking, I'm sorry, but we can't hear you.
I'll be back in a minute.
Yeah. So let's start. Do you see my screen? Is everything fine? Okay. First, I will start with a little bit of introduction. I studied human medicine at Damascus University between 2011 and 2017. Then I moved to Germany. I'm studying a master here in translational neuroscience. I'm also studying a postgraduate certificate at Edinburgh University in stem cells and translational neurology. Since 2014, I was part of Cochrane, and since 2015, I was part of the Association for Evidence-Based Medicine. And those two associations teach me a lot, taught me and still teach me about information resources, meta-analysis, systematic reviews, and a lot of other things. Actually, I wanted to everybody of you to introduce himself, but I understand that internet connection would not be that good in Syria, and I don't think we have a lot of time. So please, if you can send your name, your current work or studies, and your motivation to attend this workshop, as well as your expectations. Because if I understand those expectations, I still have the time till tomorrow to fix the things that I wasn't planning to talk about. Please feel free whenever you want. If there is something that is urgent, please just unmute yourself and tell me about your question. If you think it can be delayed, just keep it in the chat room, and I'll talk to you later. Let's talk about the organizing of this workshop. So we will have about 30 minutes to 40 minutes of this session now. Then we will have about 20 minutes break with some mini tasks, and I will be available to reply to you if you want to send me any question via email or whatever, and I can also keep your questions till the second session. So the second since we started at 6, 30 to 40 minutes, then 20 minutes for the task, then the second session will start at 7 sharp. It will be 8 Damascus time. I don't know what will be Noor's time. Then 7 sharp, we will start the second session. We can answer a little bit some questions and then go forward, and still the same that occurred for the first hour will happen in the second hour, and same will apply for tomorrow, first hour and second hour. For the second hour, you will get also an invitation to a Zoom meeting via email. So please just check your email during the break in order to join the next meeting. We can talk about the program, but I think let us keep it short. First, we will talk about the importance of information resources. Then we will talk about the resources, journals, publishers, databases, search engines, whatever. Then today we will talk a little bit about Boolean operators and the basics, how to search. Then we will have some tasks for tomorrow. Tomorrow we will go into details for PubMed, Cochrane Library, Google Scholar, how to search them. We can also talk a little bit about Ovid, Web of Science, Embase, but I don't think it is important, especially that we only have 4 hours. Then we will talk a little bit about reference managers, how to choose a journal for a publication, and when to cite what. And I think it is important when to cite what. So till now, is everything fine? Can I? Is it only Bishar? Can anybody tell me if he can just watch the chat room, because I can't actually see it when I'm sharing my screen. So if somebody can see the chat room and tell me when something is wrong. So Bishar, is it okay now or not? Anybody else is hearing me?
Do you hear me?
I hear you, Elisa.
Okay.
We can hear you. We can hear you. It's okay.
Yeah, because we can hear you. I think obviously there's still the problem. Otherwise, Bashar would have responded.
Okay. So Noor can see the chat room, but please just keep an eye there in case there is something urgent. But please just don't bother. Okay, so now you see my screen again, I guess. So why are we talking about information resources, and why it is an important thing to think about information resources in medicine or medical sciences more than others, other fields of science? First, we need to know that the dramatic effects of treatment are really rare. For example, some surgeries, the patient undergo the surgery. Before the surgery, he's super bad. After the surgery, he is fine. but that is rare. A lot of the diseases, a lot of the drugs do not have that dramatic effect just before the pill, after the pill. So what does that cause? We do not have certainty. We can't be sure that treatment causes the effect or the disease went on itself spontaneously. Something that happened before with the flu, with other diseases. The disease, for example, sometimes we do not need to screen for the disease. We do not need to treat the disease. It will go away by itself. So uncertainties are very common. Then when we have two drugs, the differences between the two drugs are not that like one drug is effective in 90% of the cases and one drug in 60% of the cases. It's usually very close to each other. So we need to be very, to go into details to understand that and to differentiate our options. Sometimes we think that one drug is better than another drug, while in fact, or in other studies, it is not. So what is happening? If I read a study and this study says, okay, this drug is better than this drug, it can be that they maybe use the ideal dose for this drug, for drug A, and not the ideal dose for drug B. So this causes us to think about when we compare, we need to compare like to like. So we can't compare both drugs with 5 milligram while it is not 5 milligrams the effective dose for each one of them. We need to compare the effective dose for each one of them. We can't compare a drug that is more effective in elderly to a drug that is more effective in young people. So that doesn't work. Yeah. Noor, is there anything?
Muhammad is saying that he has problems with the voice.
Actually, I'm sorry, Muhammad, but I think you need to try to fix it as soon as possible, since we all hear and hear, see, and can speak to each other. So I think it will be a problem with your microphone or with your speaker. Noor, if you can just send him by writing, because in case he's not hearing me, I'm doing
okay. Okay.
Thank you so much, Noor. So okay, and in case I'm comparing like to like, is that enough? No, there is a lot of other factors that are called bias that can limit the trust we can have in the results we have. So in medicine, we have three dilemmas. When a patient comes or when we have a question, we do not ask, just give me any drug. The patient comes to say, give me the most effective drug. So in case we have many, choose for me the best one. This is the efficacy is the first thing we can think about. Then the recency. So, since we have a lot of drugs, they didn't all together appeared out of nowhere at some point of time. Some drugs appeared in the 90s, some drugs appeared recently. So when we are telling, for example, if I tell a person, this is the most effective drug in 1994, for example, that doesn't apply now, for example. So recency is another question, and you can see here this Dr. Prowell said one time that he feels sad when he see the reaction of his medical students when he tells them that half of their medical knowledge will be changed in 10 years, and the problem is that their teachers do not know which half has changed. So this is actually a very big problem, and this was the Dean of Medicine at Harvard University. And then, okay, I have this drug and it is effective and it is recent. Is that enough? Not really. when I tell you about this drug, I can't tell you about the efficacy, but maybe a lot of case reports talk about side effects of this drug in such a case, a case that my patient has. So also we have the problem of completeness. I can't report something just because it is effective and it is recent. It needs to be, my search needs to be complete. My information needs to be complete in order to have trust in my search. So do we always have to do that systemic search to find everything? Not really. Sometimes, okay, I can search and find a recent systematic review. A systematic review, for those who do not know, it is a paper that gather all available paper in one field, not in one field, actually in one field, and that answer one question and accumulate them, do a meta-analysis, gather their data, and then find one result that represent all these studies and tell me this is the result, and you can trust it. They have tables for how much you can trust this result. So yeah, sometimes I can be satisfied with this systematic review. Sometimes no, I need to do a little bit more. Sometimes I need to do all of it. So, but everybody needs to assess when to do what. So for example, if I'm publishing a case report and I'm saying in my case report that to my knowledge, this is the first case report that is reporting blah and blah. So to my knowledge, this is the first case report. I need to search at least 2 databases using two search engines to feel confident with my sentence. I can't only just search Google Scholar and tell, there is no study that reported blah and blah before. That doesn't work. For systematic reviews, of course, you need to search at least 2 databases, but the recent recommendation, and we will see that maybe today or tomorrow, that we will need to search at least 2, but more preferably 4. So the sources of medical resource, medical information. I'm sorry. So we have journals, we have publishers, databases, search engines, other resources. So we will start with a definition of each one of those. First, we have the journals. When we talk about journals in medicine, we are talking more about peer-reviewed journals. What do we mean by peer-reviewed journals? First, a journal is something that is a publication that is published periodically, so annually, monthly, whatever. This publication takes the information from researchers and convey it to clinicians, physicians, residents, medical students, other researchers, everybody. So how does the journal work? The journal is like the core of communication between the author, who is the researcher who found the data, who found the outcomes, the results, the findings. He writes his manuscript and sends it to the journal. The journal takes it and sends it to the editorial board. Editorial board, it represents the journal. This editorial board reads the paper and says, okay, this paper goes with the scope of our journal. Let's send it to the reviewers. So who are the reviewers or the peers? Those are people who can do the same work as the author, as the first author who wants to publish his study. So in case I send a paper to my journal, I work in neuroscience, they will take this paper and send it to Elisa, because Elisa can't do the same work I can do. Okay, so what will Elisa do? She will read the paper, she will assess it, she will put comments, and recommend either publishing or refusing it, and then she will reply to the editorial board, and the editorial board have their own decision, either publishing the paper or denying the publication. So if they wanted to publish, they send it to the publisher, which is a company that we will talk about in the next slide. And when it gets published, it arrives or reached the readers, who can also be other researchers. So each peer-reviewed journals consists of several articles. So here you can see one of the articles. An article is usually talking about one concept or one project. Some projects have several papers, but a lot of projects only get reported in one paper. And this is a process you can see on the right, that how an author publishes his study in a peer-reviewed journal and the peer review process. Author, editorial board, peer reviewers, then the paper gets back to the author. In case he accepts, there are three types of replies. Either they reply, we refuse your paper and we ask you not to submit it again. Then they might reply and tell him, okay, we have major changes. If you do them, we can assess it again. And then they can also refuse it, but see, those are our major changes, and they can be done by the author or not. The author can also deny doing these changes. The third kind of replies, we have minor changes that just correct some grammar, correct a figure, correct something, and we will publish it. Okay, very few papers get published without any changes. So, how many papers do we have? Actually, we have a lot of papers, millions of papers. There was a study that says every 20 minutes, we have a new paper indexed into PubMed, and we will talk what PubMed is. However, now let's move to publishers. If you can see here, the New England Journal of Medicine is a journal, but what is the publisher? If you read recent papers, you will see one of those logos. Those are very common. The publisher is a company that builds the website, prepare everything for the journal. So Hindawi, for example, they have many journals. Each journal that wants to be published by the publisher Hindawi goes to that publisher, and they give them money and tell them, okay, we need to be one of your journals. So you can't say that my paper is published in Wiley, okay, because Wiley is very wide. You can't say what aspect of science you are publishing in. So you need to specify the journal, but each journal usually publishes with one publisher. So Elsevier, Wiley, Springer are very common. So are all journals the same? Wherever I publish, it is similar? Not really. There are journals that are better than other journals. And when we talk about comparing them, there are a lot of numbers, but one of them is the most common one, is the impact factor. So the impact factor is the total number of the citations that happened in the last 2 years for all the papers in that journal, divided on the number of citable papers. Okay, so the total number of citations, by citations I mean the number of studies that used information in the papers in this study. So if I have a paper, a citation means, Lynn used my paper. She says that she used my paper and she puts my paper in her references. This is one citation. And a lot of other citations can happen to my paper. But another paper, for example, had more or less. So the average of them is the impact factor for the last 2 years. Where can I find this? You can find it on Web of Science, or you can find all of them. The New England Journal of Medicine, the Journal of American Medical Association are examples of high impact journals. So, do researchers have also a number that represents how important they are in their field? Yes, actually. So how we say that the citation means, we can say this journal publishes 1,000 publication per whatever, but it is not important the number of articles. It is important how people are making use of these articles. So if I publish 100 paper and nobody reads them, it is not that good for me. I'm publishing nonsense. But if I publish one paper that is read and cited by 100, that is an important paper. So what is the H index, which talks about the person, the researcher? Also, sometimes they publish or they mention the H index for journals, but it is the most common for researchers. If I say Grace, for example, has an H index of 20, that means that she has at least 20 papers that are cited by 20 other papers or more. In case I say 2, I have an H index of 2, then I have 2 papers that are cited by 2. Okay, so in case I have 5 papers, 3 of them are not cited at all. 1 of them is cited by 5. 1 of them is cited by 2. Then my H index can't be 5 because I don't have 5 that are cited by 5. I can only have the 2 from here and the 2 from here, so my H index is 2. Where can I find this? I can find this on Web of Science and also on Scopus. We will see Scopus in the next few minutes. So please, this is task 1. In case you want to do it throughout the break, just take a screenshot of this task and keep it. But let us proceed till we finish. So I just need you to find the 3 journals for neurology, know their publishers, know their impact factors, and find an article in each one of them and capture the abstract. In case you can send that to me via email during the break, that would be perfect. In case you couldn't do it, just please let me know and I will try to help you. So, how many electronic resources for medical information do we have? Actually, many resources are there. So in 2014, they said that we have at least 46 places to search for medical articles. 25 of them are databases, 8 of them are search engines, and 13 are libraries. What does that mean? That means that I have different ways to search for medical information. So which one is the most important for me? And that's why we will talk about them a little bit, and you will decide where to search for what. So Medline is the first and the most common. It was prepared by the National Institute of Health in the United States. That's why most of the American papers are published there. Medline is freely available. It can be searched by Ovid and also by PubMed, which is also free. We'll try it. It has more than 26 million articles and it has more than 5,200 journals, 60 languages, and its indexing terms are called mesh. We will use that. Next, we have Embase. Embase is another database. By database, what do I mean? Database is like a container that includes whole journals. Okay, so it is something larger than a journal. The database do not have the papers. They can refer me to the papers, but they have all of them searchable in one place. So it is exactly like a container. So, for example,
Someone has a question in the chat about if the course would be recorded for later.
yeah, it will. It
Okay.
will be. Thank you, Noor. So, Embase is another database. It has 23 million articles, 8,500 journals. However, Embase is paid. Embase is prepared by Elsevier, and it includes most of the European papers. The indexing terms of Medline were mesh. The indexing terms for Embase are called Emmetry. We can talk about them later. Scopus is another one. It has more than 69 million records. It is the biggest. It is also paid. And if you remember, it gives a profile for each researcher. It says, this researcher has an H index of blah, and so on. Web of Science is something even larger than a database. It includes in its core collection 6 databases, and it also includes Medline and other stuff. Also, Web of Science is big. You can see that it contains more than 90 million records. By records, we are saying about papers. It is by Thomson Reuters now. So Cochrane Library is something more specific than the other ones. It is a database, but everything in the Cochrane Library are systematic reviews with or without meta-analysis. You remember what we talked about, the systematic reviews? So when we want to search and I just need something or one paper that represents that question, I have a very specific question. I might go to Cochrane, search, and I find one systematic review that gives me very critical and reliable answer for my question. They developed another branch that includes RCTs, which are randomized control trials, and this branch is called Cochrane Central. Cochrane is free in some countries. In Germany, it is free. In Syria, it is also free for different reasons, but yeah, it is free. So this is task 2, and please just think about it. We have something called library and something called database. It might be difficult to define each one of them, but I just want you also to take a screenshot of this and add it. This is task 2. We can discuss that tomorrow. We can discuss that via email, send each other links that talk about that. But yeah, it's not clear, and you won't see a clear answer. It is a harder task than the first one. So, what are the optimal database to search for, to search in? As we said before, we have to search at least 2 if we are doing a systematic review. If I need my answer to be recent, complete, and search for effectiveness, I need to search several databases. Here in this systematic review, they suggested that we search at least Embase, Medline, Web of Science, and Google Scholar. And not sometime, a lot of other times, they also add Cochrane Library, especially the central, to include these RCTs. So 5 databases, 2 gather data, then we think about the results. We are just preparing the papers from 5 databases. PubMed, what is PubMed? PubMed is the tool that is free, that will be the most important one for us. It mainly search Medline and it searches some other stuff. It uses mesh terms. The mesh terms are the indexing terms for Medline. And I think you remember that. It is free of charge and it provides an advanced tool to search it. PubMed is giving all papers indexed in that PubMed. PubMed is a search engine. It searches Medline and several other databases. But this PubMed gives each paper in all these databases a number that is called PMID. So if I have a paper indexed in PubMed, I will have this number PMID. If I have my paper indexed in MBase, in Cochrane Library, wherever, it won't have that number. So can my paper be indexed in several databases and can it be searchable via different search engines? Yeah. The high impact factor, the high impact journals, the important papers are all included in several databases. Okay, so this is why people usually aim to publish in a high impact journal. Why? Because it is indexed in several places, it will be read by more people, and then it will be cited more. Ovid is another tool. It can search Medline, MBase, and also other places. It is also paid. We can try it, but we need to see how much time is left for us. Ovid is more complex than PubMed. PubMed, you can, if you can see here, there is a search box like in Google. I can do a quick and dirty search, but in Ovid, it is already giving you the advanced mode and you need to dive into details. Is Google Scholar, Google being very bad options? Not really. 1 in every 20 Google search are for health-related terms. It is important. We can do that. We can search Google Scholar, Google. It is not about the way to get to papers. It is where the papers are. If I get it by a suggestion of my friend, it can also be an important paper. Okay. So, we have now talked about everything we need to talk about before the break. Now you have to do the, or I think you should do the 2 tasks, and I will send you the invitation for the second meeting in a few minutes. So see you and have a nice break, 20 minutes. Hello, everybody. Nobody approached me for any question during the break, so it's either that you all did your work without any problem, or you did the work with problems, but you were shy to approach me, or you didn't want to do the work. So can you tell me which option is it? If at least one of you can join activating the camera, I will feel more comfortable. Not enough time for you, Noor. 20 minutes for 3 papers, 5 minutes per paper. Yeah. So, welcome to the second part. So, does anybody have any question or problem to be solved right now? If you think that is something that to be discussed publicly, we can talk about it. Oh, okay. So Grace, whenever you want, just send me your email and I will reply. Aha, no, you keep eating. Okay. So let's move on. Okay, so if you remember, is there any question approaching? Or just noise? Yes. Just noise. Okay, so let's move on. Before the break, we talked about journals, publishers, databases, search engines, libraries. Now we are talking about other sources. What are the other sources I can search for or search in for medical information? There are guidelines. What are the guidelines? Those are papers, sometimes are larger than a paper. Sometimes they are published in a journal normally, like other papers are. Sometimes no, they have their own website and they get updated more oftenly. That depends on the disease. Guidelines follow the classification of diseases. So I can have a guideline for migraine, a guideline for a neuropathic pain, guideline for whatever. Okay, so what is the importance of guidelines? They gather the most recent information, put them together, and tell me when a patient comes, you need to do 1, 2, 3, 4. Okay, it is very good. It is something that we can rely on if we are talking about the systemic work in a hospital. I can't rely on every doctor at my hospital to search all the papers and find all the good papers, read them, criticize them, and find the results. No, actually, we can depend on guidelines because those were gathered and published by a very experienced researchers in the field. Usually we have panels for guidelines, so even patients can vote for each point in the guideline. Guideline can also be a source of information that is more applicable. So if we say that, okay, one drug is better than another drug, that is good, but it is better with efficacy difference of 1%. However, this drug is 100 times cheaper than the first drug. So can we say that everybody should take the first drug in case the situation of the disease are not that severe? So not really, actually. Many people can take this second drug, and in case it is not effective, we can move to the first drug, and we call the first drug a second line. Being cheap is very important. Being accessible is very important. Everything can be included in a guideline, but we can't assess that in a paper. Okay, so it is important to have guidelines. However, sometimes the guidelines get updated every 2 years, every second year, and sometimes every 10 years. So sometimes I can't rely on a guideline published in 2008 and I'm treating a patient in 2020. Okay, sometimes I can do that, sometimes I can't. So now you know the good points and the bad points about guidelines. Up to date is a very common source of information. Here we have reviews, a lot of reviews. Each review review a disease from etiology to diagnosis, to the pathology, to the investigations, to the treatment options and everything. Okay, those papers are peer reviewed by the reviewers of Up to Date. Many of these papers are recent. However, when you read these papers and rely on them, you need to check, okay, after each sentence, you have the reference. If you are depending on that line, on that exact information, you need to check the reference. Is it recent? Is it old? Okay, because those are reviews written by people, reviewed by people, so a lot of mistakes can happen. Okay, we are not in a position to assess Up to Date as a whole, and nobody can, but you need to make sure of the information you are taking. Medline is another option, also very accessible. You can search it. Yeah, right. I need to tell you that Medline is free. However, Up to Date is paid. Sorry, I'm saying Medline, and it is Medscape. Medscape, you can search it on several devices. They have several languages. For languages, actually, they have sometimes courses for specific issues. And a lot of options are available from Medscape. And also that fact about checking the source of each information applies to Medscape as well as Up to Date. Textbooks. Textbooks are also a very important source of information, especially when we are talking about medical students. They can't read guidelines of 100 papers for migraine, and they will specialize in gynecology, for example. Textbooks, when we are talking about the pyramid of evidence, they come at the very lowest level. Why? Because they are only opinions of the writers of these books. Sometimes they are reviewed. However, you can't maintain the quality of textbook. However, each textbook needs to be assessed on its own. For example, we have textbooks that get published every year with citations, with recent papers. For example, we have the Pocket Medicine for Internal Medicine. This is a very good book and very recent. Each year that we have an issue and with updated information. So each textbook needs to be assessed on its own. And then we talk about ResearchGate. Can I say that I published my paper on ResearchGate? Actually, ResearchGate is not a journal, it's not a publisher, it's not a database. It is something like Facebook. Okay, I enter, create my account, talk to other researchers. It has many researchers, 15 million actually, the largest social networking site, but it is a social networking site. I can put a preprint, but a preprint is to be read or revised by my friends, my fellow researchers, but it can't be used as an end place for my paper. It needs to be published somewhere. Then I say on ResearchGate that I have a paper published somewhere, and here you are the link. Okay, and it is free. So here we end the information resources section, and if you have any questions, please let me know. Any questions? No questions? So let's move on to the more interesting part. Okay, here can you please just read this case? I was searching for the treatment of glioblastoma multiforme and I found this on Medscape. So, what do you think about it? We have surgical resection, radiotherapy, and concomitant adjuvant chemotherapy with temozolomide. Patients older than 70 years, less aggressive therapy, and sometimes considered using radiation or temozolomide alone. And they have reference papers. However, I need to investigate that information more because I don't trust those 3 papers. Okay, so let's try to search this second part. Okay, the treatment options for patients with glioblastoma multiforme. And I need to know which is better, radiation or radiotherapy, and temozolomide, which is a kind of chemotherapy. Okay, so first what I need to do is to define a BICO. BICO is the type of questions I can enter and search for it. Okay, so B is the population, I is the intervention, C is the comparison, O is the outcome of interest. So population, we have the population, right? Glioblastoma multiforme. Intervention, we have temozolomide. Comparison can be radiotherapy or the other way around. My intervention and its conversion. The outcome of interest, I need treatment, I need quality of life, what kind of outcome I need, okay? Sometimes they add to that the settings, BICO-S, or sometimes they need the timing, whatever. So you can add to those, but those are the most basic information you need for your search. I need to understand what I'm searching for. So I compare radiation to temozolomide for glioblastoma multiforme in 1 year survival. Okay. So I skipped on the age of patients. I will just say glioblastoma multiforme. I'm sorry I prepared them on slides, but it is faster than going and writing them down on the search engine. But you will see how it works, and we will have a small task for tomorrow, and I think it will be easy and effective. So this is the first step. We define the BICO. Then the second step. The second step works okay. I have each one of those columns representing one of the BICO letters. Okay, so first I have the B. Here you can see the population. Okay, can I say instead of glioblastoma multiforme GBM? Yes. Okay, then let me go to the intervention. Can I say temozolomide? I can also say chemotherapy because temozolomide is the chemotherapy for glioblastoma multiforme. So sometimes in some papers they will say chemotherapy and sometimes they will say temozolomide. they might not mention both of the words in their abstract or in their title, right? They might say chemotherapy and radiotherapy for glioblastoma multiforme survival. They can also say the comparison of temozolomide and radiation therapy for GBM for 1 year survival in that shape. Okay, so if you agree with me that we have several columns, the BICO, and for each part, for the B, I have several terms, glioblastoma multiforme, GBM. I can also have other names for other diseases. For the intervention chemotherapy, temozolomide, I can also have the abbreviation for temozolomide. I can also say chemo, conversion radiotherapy, radiation therapy, what we have as other options. Okay, so we need to classify them and put them in such a table. Okay, please stop me when you have any question, because this is the most important part of the workshop. Then I need to understand what are the Boolean operators. So first we have the AND. If you can see here on the upper left side of the slide, travel and tourism, it only gives me the part in the middle. However, AND gives me the lowest number that is shared between the two circles, or gives me the largest number of options that includes all the options in the middle part, in the common part, and also in each one of them. Not is something that, okay, if I want a travel but not tourism, it will take only travel and subtract the papers that has tourism in them. Okay, and you can also take that and apply them for other circles, how many circles you want. For example, or first, then and, or and first, then not, or therefore, then or. Okay, so I will move on, but I trust that you will ask questions when you have them. So here, where do you suggest I would add and where do you suggest I should put or? If you know this, I'm not afraid that you'll understand everything in the workshop. So here I have
we would.
Yeah, tell me.
Or in the columns, like intervention, I would chemotherapy or temozolomide, but I would say and like for each
in between columns.
In between columns, I will put and.
Okay, so or between each of the terms in the column, because each paper can say this or this, this or this, and it can be a column or 10 terms. Okay, so I'm just putting just two to make it simple, but Noor was totally right. Then, okay, between intervention and conversion, I can't say that I will need chemotherapy or radiation therapy. No, I will need both of them to be in the paper to assess the difference between them, right? So I will need and between each one of those columns. So now I'm ready. So whenever you want to search something, you need to get that table ready. Then you go to the website, to the place you want to search. How do I get more terms? In case I just know glioblastoma multiforme, I search glioblastoma multiforme, I see some, I search Google for it, okay? Just glioblastoma multiforme. I see if it has different names, if it has different abbreviations, classifications. I search Wikipedia, wherever, to see, to find all the terms. And sometimes I read a few papers of my search and then I decide, okay, I actually missed some terms. Then I return and apply the search again, adding those terms. Okay, now I go to PubMed. This PubMed page I think it is familiar to all of you. But if I use this search box, this white box, as I use Google and put the terms, it will give me some papers. They are improving that search, but that search is called quick and dirty. It will give me a quick answer. The first paper, which will be very relevant, it will include most of the terms I'm searching for, but it is not complete, it is not comprehensive, my search. So what I will use is the advanced. You can see that button advanced below the search box. And here on the left, you can see if you want to search PubMed as a whole, or only Medline, or only other databases. I pressed advanced. Okay, so advanced, you will see here, this is what advanced look like. I will just don't worry, I will try to send. Maybe the lecture is recorded, so I tried to upload it before tomorrow in case somebody wants to see the first part, watch the first part before tomorrow. See, so here we have a place where my search will go. Okay, here I have the search builder. Okay, in the new PubMed, like it was updated 2 months ago. I'm sorry, those pictures are a little bit outdated, but it is similar, just reverse them. Okay, so you won't find any difficulty in that. Okay, what I need to do is to search. So here, you can see here, this is where to search. Temozolomide, okay, and it is spelled wrong here. I searched if it is one of the mesh terms. You know the mesh terms, you remember the mesh terms? Those are the indexing terms. Those are when a paper goes to PubMed, and there are people who index papers into that database. Okay, so they read the paper, they say, okay, this includes, for example, skin biopsy, neuropathic pain, SFN, okay? Say they defined several words and they say, okay, this paper should be indexed with those words, okay? So the best way is to search using those words. So let's start, we start first, usually. This line is similar to this line, okay? So all those lines are the same. So first I choose title or abstract because temozolomide was not used in mesh terms, okay? But chemotherapy is a mesh term. It is a common mesh term. Then I will use mesh term here, and I will try to type chemotherapy, and PubMed will complete it for me, okay? So I used chemotherapy as a mesh term, and temozolomide, I searched it in title and abstract. I don't want to search the whole paper for temozolomide because a lot of papers can include that in their discussion, in their methods, results, wherever they want. And I don't want to read all those papers. I just need those who focus on temozolomide. So only title or abstract. So here, what do you suggest I should put between the two lines, and or?
Or.
Exactly.
Or.
So, exactly. So here we have or, temozolomide, chemotherapy, one of them mesh term, and one of them is it's title or abstract. Okay, and when I put search, I have two options. Either I put search press search, and it will take me to the page of results, or I would add to history, and you can see it here and next to search, and it will just take it down to that field here, history. Okay, so if you remember, I searched temozolomide as title or abstract, chemotherapy, title or abstract, or mixture, like it is an example. So whatever you want. Okay, don't think about the filters for now. Okay, we will talk about them. So this is the first column. It is now a line, and here it will give me the number of articles that are available with these terms. Okay, then I use radiation as title and or abstract, and or radiotherapy also title or abstract. Okay, so here we have 21,000 items. Then glioblastoma multiforme, GBM. Here also mesh terms. Okay, so here I have several lines, and here is the last one. 1 year survival, or I press add to history, and it gets into the history. So then I have my 4 columns put now into 4 lines. Okay, is that fine till here?
I have a question.
Yes, please.
How many items are ideal for your research? It shouldn't be like 50,000. It should be down to, I don't know, 17,000.
Actually, there is no rule for that. Okay, sometimes when I'm doing a systematic review for influenza, for example, if I get 50,000, I would say, yeah, enough. But when I'm talking about a very rare disease, SLE in a very specific form, and I get 50,000, I would say, of course there is something wrong. Okay, when I'm talking about glioblastoma multiforme and I'm getting 2 papers, it is also wrong. Okay, so it depends on the terms I'm using and how focused I am.
Mm-hmm.
So,
thank you.
Hello. Yeah, you're welcome. So now we have 4 lines, and those 4 lines are ready with a button called add here. Okay, we didn't use that. What does that do? When I press add, it returns it to here. Okay, so when I finished adding those 4 lines, I have nothing here. Okay, then I need to combine them. I can't work on them while each line is alone. So I press add, and put and between them. Okay, so everything here is or between the terms, and we said forget about the filters, and we have all ands here to combine the lines. Okay, sorry. Yes. Now, after I added everything, I press search or add to history, but search because I need the results now. The results are 280. You can see here 800, 50,000, 20,000, 30,000. So there are a lot. Here, when I combine them together, the thing common in between them is only about 300. After that, can I also reduce the number? Yes. On the left, you can see filters. You can press clinical trial, and this is the thing you see here on the right, and clinical trial. Actually, I applied the filter, but also you can clear it from the small button clear you can see here, right to the clinical trial. And you can also apply a filter for the last 5 years. You can apply a filter to see only free full text. You can apply a filter for humans, and you can apply more filters. You can here show additional filters and apply more filters till you are satisfied with the number. Okay. So after I applied 3 filters, I'm having only 24 papers, and I think that is enough. But I returned and I think, do I have to change anything in my table? When I thought glioblastoma multiforme, the population, I can't change anything about it. The comparison, the radiation, and the chemotherapy, I can't change anything about it. But the outcome, actually, the survival, it is not mentioned in all papers. Okay, so I know a paper that is very important, the paper I got from Google, and it is not in those 24 papers. So I read it and I found out that, okay, survival is not there. And by telling about survival, I'm mentioning just an example, okay? But sometimes we need to remove the comparison, for example. Sometimes we need to remove the age. If I'm adding a column for age, I need to remove the age and apply it as a filter, or don't apply it at all. Okay, so sometimes I return to my table, modify it, add more terms, remove more terms. Okay, so BICO is something to draft with, but you don't have to stick to it as long as you have new terms or new ideas to remove your old terms. After I removed the survival, I got actually 5 more papers. You can see here. Oh, actually, I didn't refer to where the results are. Here, first, before removing, I had a 24, and now after removing it, I had 29. Okay, so okay, now I got the paper that was missed, and I'm satisfied with that search, and I will read the papers. Is that enough? Not really, because do I have to do the search and all the steps every time I need to read one of those papers? No. There are a lot of programs that are called reference manager. When I have my search done, I import them into my library. It is something similar to my library, my physical library, but electronic library on my computer. You can see here from the right, you can press send to, you can send them to your email as well. But the most applicable way, and reliable way, is to send them to Citation Manager, because you can edit them, you can remove one, you can add one, you can add full text, and so on. So after you add them to your library, you have them all on your computer without the full text if the full text is paid, but you can also search for the full text and import it to your computer and attach it to that record. We can talk about reference manager, but I don't know if we will have time. However, we have a lot of tutorials that I will handle to you tomorrow that talk about other search engines and other tutorials for programs like this. So first, don't forget to use several databases in case you want to. And when you use several databases, remember that some papers are indexed in several databases. So when you get, okay, actually those papers are the same, are duplicated. So this program also will help you to discard these duplications. If I get 100 from PubMed, 200 from Embase, I match them, then I find that 50 of them are duplicated, and I remove them with one click using EndNote or Mendeley, for example. Then you will read and assess those papers and find your own conclusion. However, we need to keep in mind that medical information resources, they will give us only ideas, okay? known ideas or investigated ideas as long as they can. However, evidence-based medicine and evidence-based practice, when I want to apply this research to the patient, I need to combine that with my clinical experience or research experience in case I'm doing research, and I need to apply the preferences of the patient, his values, his expectations, because those are actually important. Here we have the third task, and I suggest that you do it for tomorrow using PubMed. Now we talked only about one search engine. So now I need to publish a case report. I found a case that is interesting, actually. This case is a person with a disease called marble bone disease. I don't know this disease. This is a disease mentioned on the patient record, and it has discitis. And the professor in the visit told us, okay, it is strange to have discitis with this kind of disease. So I need to search, is it actually an important case report to report for the literature, to add to the literature? Does it add significant things to the literature? Should I publish it or not? Okay, so here you do not have all the BICO, okay? You only have two things for the population. So I don't have intervention or anything else. I only have two columns. Each of them is population 1, population 2, or condition. You can, and you need to find the terms for them, apply them, and it will be a search of 2 lines. Okay, so please try to do it. Please take a screenshot. I will send it to you by email also. And those were my references. And thank you very much for attending this session. So if you have any urgent question, I can answer. And also you can approach me whenever you want, today, tomorrow. But better to approach me after you try your search with these terms. So please tell me, is there anything that I can help you with now?
I have no questions, thank you.
You're welcome. I'll try my best to combine the two videos and upload them and send them to you via email today. I'll try my best, or tomorrow morning. And please try to do it yourselves, the task, and see you tomorrow. And feel free to ask me any question you have. Actually, if Mohammed, if you can do the task, you do not need to send it anywhere. Okay, if you can do the task, just tell me and I will help you with. So see you tomorrow. Bye.